Another procedure we've seen excellent results with at Grand Rapids Orthopedics is outpatient partial knee replacement. Oftentimes, arthritis in a knee is primarily involving one joint, the medial weight-bearing joint, and as such, that can be the part that's replaced rather than the entire knee. Advantages are many, including an outpatient procedure rather than an in-hospital procedure, a less involved procedure with a third of the incision, and a third of the recovery in general. In addition, the parts that are placed in the knee allow for better function, better range of motion, and a mobile bearing that more naturally replicates the range of motion we experience normally in our knees. With an outpatient partial knee replacement, the procedure is done in an outpatient setting. Generally takes approximately an hour. Patients are returned to their home, and we have a visiting therapist who can provide therapy if necessary in an at-home setting. Patients are weight-bearing immediately and walk into the office at 2 weeks postoperatively without any adjunctive aids, most commonly. It's important to note that not every person is a candidate for an outpatient partial knee replacement. If you have arthritis in all the compartments of your knee, you may require a total knee replacement. But if you are a candidate, it can be an excellent solution to the problem. Based on our detailed discussion with you in our office, our physical exam, x-ray evaluations, a preoperative determination for the best procedure for you would be determined. However, if at the time of the procedure it was determined there was more involvement than was expected, an additional or alternate procedure could be performed, even in that outpatient setting. Several of the key things that patients appreciate about a partial knee replacement is the smaller incision, the more rapid return of motion, and the more normal feel of their motion in the end following their recovery. Patients often are able to return to their desired activities much more rapidly than with a total knee replacement and can perform some activities such as kneeling in a much more comfortable fashion. Another benefit with outpatient partial knee replacement is the cost. It is dramatically less to undergo a partial replacement in an outpatient setting than a total knee replacement in an institutional setting. Generally at least $10,000 cheaper. At Grand Rapids Orthopedics, we always pursue conservative options first. There are a variety of conservative options for arthritis, including pills and anti-inflammatory medication, injections, lubricating shots, lotion that has an anti-inflammatory in it, laser treatments, bracing. But if you're having knee pain, if you're having concerns with regards to knee arthritis, we'd be happy to evaluate you and give our personal best recommendations on options that might be appropriate for you. So if you're having knee complaints, we'd be happy to see you. Please contact our office and we'll arrange an appointment at your convenience.